Now we're going to hear from a medical physician, Roxana Mehran, very highly accomplished, working at Mount Sinai, focuses more on cardiology and the heart. In fact, this segment is called The Heart of COVID. We talked about the heart of the household. Nicole Friday has an amazing heart. And now we have Roxana, who is working on the heart, but also has an amazing heart. So Roxana, thanks for being here.
Thank you so much for having me. Nicole, you're amazing. I just love listening to you, and we need more women like you as major hospital administrators who really get it and understand the disparities of health and what is really going on in the real world, which there is such a huge disparity that we absolutely must close. And we need more Black doctors, more Hispanic doctors, more women doctors, more cardiologists that look like our patients, and we will make an important difference if we actually get there. So thank you for everything that you do. I was
Give Nicole a round of applause. I know you're on mute, but we look at a visual.
We need more people like you, really.
Yeah, that's amazing. All right, I'll connect you two afterwards. Maybe Nicole, you'll move to New York and help us all.
Yeah, Nicole is amazing.
All right, so you're amazing too. So tell us about you. So what's your role at Mount Sinai?
So I am the Mount Sinai professor of clinical research in cardiology, as well as professor of medicine, professor of population health science and policy, as well as professor. I have a lot of professorships.
Wow.
But I'm really
How long have you been in school?
I started when I was like crawling. I started a long time ago, but it has been a fantastic journey to get here. And I'm here to pull up more women into cardiology as the platform I told you about, Women as One, which is a not-for-profit 501c3 organization set up to close the gap, the gender gap that exists in medicine. And we started with the most broken house, which is the House of Cardiology. Very few women cardiologists are there, very few women leaders in cardiology, very few professors in cardiology. And this all must stop because we're losing really amazing, talented women who are choosing to run away from cardiology because it's not friendly to women. Much like a lot of other subspecialties and boardrooms where they don't welcome women, we want to change that narrative and promote talent. And everyone should go to our website, womenasone.org. Please go there. You'll love it. There's so many wonderful testimonials as well as many programs. So that's one of my platforms, but I am
Jarvis is going to put the website in there so everybody
can. Wonderful.
Let me ask you a question.
I'm a practicing cardiologist, and I was on the front lines during the COVID pandemic, and there's a lot to talk about. And I think the most important thing that I hope that your Domesticity is teaching everyone in their new homes and in their new lives during this pandemic, which will change how we practice and how we are socially, as well as what we're doing at our work and especially with our own families, is to remember that there's only one way to prevent the virus. And that is by the 3 W's: washing your hands, wearing a mask, watching your distance, and really going after that in a very serious fashion. Wearing a mask is not a political statement. Unfortunately, it has turned into that. And it just makes me crazy every time I turn on any of the news. I'm so glad we're on this and not listening to CNN or Fox or whatever, which turns this whole thing into a fight between Fauci and Trump. And the truth is, it's the health, human health is at stake here. I watched many people just die before my eyes without us being able to do anything for them during the heart of the pandemic here in New York City, in the epicenter of the epicenters. And I think it's really important that we get that message out. And wearing a mask and the type of the mask does matter. And I think you wanna show.
Yeah. What do you mean by the type of the mask?
I gave
so
you
yeah, I asked
tutorial yesterday.
Yeah. Okay. So yeah. Okay. So this is great. So people here in New York, especially where I live in Chelsea, I see mostly everybody covering their face with their masks, right? And
Good.
yeah, which is good. But I actually, I'm supposed to be the educator and the ZEITGUIDE, and I showed myself on Instagram wearing a bandana. And a friend of mine basically said, you should educate everybody and tell them that they need to wear a real mask. And I'm like, why? You know what? I'm going to ask Dr. Mehran about that. So why is this, which is very stylish, right? I look really cool, right? Or maybe not. Like it.
I see a lot of those, and that is better than nothing. I certainly wouldn't want, I'm happy that at least they're doing something. When you wear a mask, you are showing to the world and to everyone that you care about them. You're respecting others, and that you're being selfless, and you're respecting others because it's your body fluids that you are keeping within the mask and not aerosolized to the people around you. And so this is better than none, but I ask you, and I ask you to do this.
Yeah, how do you know if there's a good mask?
I want you to do this exercise. So light a candle for me.
Okay, hold on. Here's one. My house, talk about the new domesticity. I need to read this book because it's like all over the place. By the way, before I say that, I just want to say I'm a gay man, and I was just thinking, like, I didn't mean to leave out gay couples, gay GLBTQIA couples in that last domesticity, but that's another point of the new domesticity. So I hope I forgot to put that thing in. Brain fart. But yes, the new domesticity is about GLBTQIA. All right, so I got a candle.
Mm-hmm.
And I got a lighter. So what do you want me to do?
Light the candle.
Oh, okay. Oh, no. Okay.
Now, blow the candle.
What does that mean?
What do you think? Well,
I don't know. Well, I guess it's aerosol that's blowing that out.
Well, it's air coming out, right? Okay. Yeah. Let's wear. Do you have other masks?
So should I wear this one instead?
Yeah, why don't you try that one?
Okay.
That's the KN95, right?
It's the
one you paid $5 for.
Yeah, I bought 100 of them.
Wow.
Well, I'm hoarding.
That's nice.
Yeah.
Okay, now light the same candle.
Okay. But these aren't these aren't the ones that you're using.
No. What we're using is really turbo.
Oh, wow. Okay.
Blow that candle with all your might. Okay, well, that is, thank you for protecting me. Thank you for protecting me.
All right, everybody wear one of these. What about those blue medical masks?
Well, I think, it's better than none. And there is the question, and the big thing that I wanted to show everybody is that when you wear a mask and another person wears a mask, you're protecting each other. And then if you wear two masks on top of each other, when you have those thin ones, you could, you will protect even further. So it's really important, especially if you're going to be in close quarters with people. Now, it's really hard to exercise. Yesterday it's really hot out, and yesterday I went for a very long walk. I needed to clear my head, long walk into Central Park. And it was really hard to wear that good mask. And so I wore the other mask. And, I was really keeping my distance from others. So again, really important to wear a mask, to wash your hands, and to watch your distance amongst those 3 W's. Remember them, follow them. You did this in New York. You saw that in April 3rd, just on that day, over 500 people died in our hospitals. It was just carnage on a daily basis. Every shift we were losing 10, 15 people in our hospital system. So it was really very, very difficult to watch. And look where we are. As of Monday, July 13th, the current hospitalizations in the entire state of New York is at 820. At the Mt Sinai hospitals, 11 hospitals at Mt Sinai, it's at 32. That's pretty good.
That's amazing.
And the new positives on July 13th, just the new positives of the 4.7 million persons tested is 912. 912 as of July 13th positive, and 0 deaths on July 12th. This is unbelievable, and it is because of the close down, the complete lockdown, and also the fact that people are following some of these social distancing rules. And of course, yesterday I heard that in Suffolk County it was going up a little bit after 4th of July because of the beaches, etc. So we really need to be extremely careful.
Now, why is the rest of the country like spiking to, like they said, as much as we were in March in the beginning?
I think one of the things that happened is that they closed down around the same time that New York was getting the really, really, and New York is a very populated, extremely dense, 4 or 5 airports in the vicinity of the New York, New Jersey, Connecticut area, international flights coming in, many travelers using taxis, etc. And so there was just an explosion of the infection. And of course, the close down, I would even say, came a little bit too late in New York, honestly, a couple of weeks too late, but we were able to control it.
Contain it.
What was happening the rest of the country, especially the middle of the country, it really hadn't disseminated there. And they closed around the same time, but then there has to be this balance, right? Of like, what about the businesses? We're not seeing COVID. Why do we have to do this? And people just couldn't care and made it into a political issue and started, I was watching what was going on Memorial Weekend in the Ozarks. And I was like, oh my God. And I keep telling people, if you don't like wearing a mask, you're not going to like the ventilator very much, because if you want to feel suffocated, it's exactly that, where you're just, in a machine breathing for you. So the mask part was a huge part when I was watching people on top of each other, no masks. And of course, it just explodes. And we're seeing it now. And unfortunately, what's happening in the United States is shameful, frankly. As a world-class leader of the world, we really are not looking at all leading the way in COVID, unfortunately.
So thank you for explaining that. So New York, I've been telling people it's like Paris, right? I mean, there's like tables in the streets and they're closing the streets. And I went to a restaurant that was so responsible that I went to the bathroom. They followed me with a mop. And I'm sorry to joke about it, but I was impressed. And so if I'm having dinner with somebody, and I guess tables really aren't 6 feet apart, should I be wearing a mask? And how do you do that when you're eating?
One of the things that I do with anyone that I'm with is that, I've tested I personally have been tested 4 times already, just because of the way it is in the hospital healthcare. We're very, very responsible here at Mt Sinai and in other hospitals here in New York. We're constantly being tested and making sure that our patients are safe. But I think one of the things is to really understand who it is that you're having dinner with, and what do you know about that person? Are they quarantined or are they out and about? And not be bashful in asking them, look, what you don't want to do. None of us want this disease, because we just don't know anything about this.
That's what I was going to ask. How does it impact, you're a cardiologist, right? How is it impacting our organs, our hearts? Like, should we?
It is an unbelievably difficult virus. It is, obviously, it's a respiratory, it comes into the system through the respiratory, through the droplets, through what we call the ACE2 receptor, which is a lot in the lining of our nose, mouth, etc. And so it comes in, but the response, and it just gets, it sticks. It has these prongs that just sticks into the receptors inside of our endothelial receptors inside of the lungs, especially throughout the lungs. That's why you see this diffuse, like almost nodules all over the lungs, because the lung starts to, the body starts to respond to the attack of the virus, and therefore and it starts to replicate beautifully. It loves that milieu, starts to replicate and just go crazy. And then the body responds back with a massive inflammatory response, which has now hit not just the virus, but your entire organ system, including the heart, the kidney, of course, the lungs, more clotting, the brain, and it just is relentless and very, very difficult, and attacks the lungs, not just your own body going after the virus, attacking the normal tissue of the lungs as well. So a really, really fulminant response in certain patients. We know some patients have that kind of a very, very fulminant response with severe illnesses and death. And others could be almost asymptomatic, the younger people who could be just the carriers and walk around and give it to everybody.
Yeah, because people are like,
and then the middle ground.
Yeah, it's just like a flu, people are saying. So like we should worry if we
this is not the flu at all. I mean, people should know that it is not the flu. And one of the things that was unbelievable for us to see is we were just learning as we were going along. And what was beautiful to see is how the hospital systems got together. We used the electronic health records in pooling the data, evaluating who's working, who's at risk, what's going on, sharing that data with the CDC, sharing the data with the world and all of the healthcare group. I mean, I just hope that the world understands what these healthcare workers, researchers, scientists have done to save the human lives that have been at stake, and where we would have been without their incredible selflessness. And I think it's a really important one. As the virus dissipates, people will forget, especially forget what these healthcare workers did in the heat of the moment. And just
will it dissipate?
Jumping in.
Will it dissipate, you think?
Excuse me?
Will it dissipate at some point? Or
I think so. It's like anything else. You know, it's what's in fashion. Everyone's talking about healthcare workers when things were terrible, and then the moment, France
COVID.
just gave. You know what France just did? The entire country of France gave $9 billion in increasing salaries for healthcare workers who were working during the COVID pandemic. You know what's going on now? The hospitals are all suffering because what's happening, patients are not coming into the hospitals, and the hospitals are under huge financial duress. And what we're hearing is, look, we have to make cuts. And we're like, what? Everybody was working around the clock, cuts and everything. I mean, they're doing their very best, but it's going to be difficult.
Well, no, I was actually talking about COVID. Is that going to dissipate?
Oh,
the actual virus. Yeah.
No, the virus, I'm sorry to say, I said it very early in February because I had very close colleagues in Italy, in northern Italy, and they were showing me, sending me chest x-rays, telling me, we've never seen anything like this. What do you think? And when I saw that and I started to see that it was coming in, I just said 2020 is finished. And it is. I mean, we cannot be traveling. 2020, just put it out of your mind. It's gone. And what you have to hope for is the new normal. And even if the vaccine is available, you remember that even if you have a vaccine, not everyone is going to develop antibodies. It's not 100% for everybody. We have seen people who receive vaccines for the flu vaccine and then end up getting the flu anyway, because the virus gets smart, starts to make new strains, etc. So we are going to have this new normal and continue to work around the clock in understanding how to be ready and how to protect everyone if this doesn't go the way it's supposed to. And this whole idea that, oh, we're all going to be fine by next year when the vaccine comes, I think we need to, yes, let's be hopeful. I don't want to be all negative. I want to give a positive vibe. Look what we did in New York. You can do it too in your state. I think we have to just understand that it's not going to be a slam dunk.
So do you feel that we're going to be wearing this for the rest of history?
I think if you see what happened with SARS,
yeah.
We were seeing Asians here I travel a lot, and I would go in Asia, and almost everyone, even though there was no pandemic there, most everybody was wearing masks because they understood that such a thing could happen again. And I think they were very much more ready for a pandemic like this because unfortunately they experienced SARS. And of course, we now have to think exactly in that direction, unfortunately.
All right. Well, you probably have to wrap. Do you have to wrap up, or do you have some more?
I wanted to touch base for everybody. You started such a beautiful piece on domesticity and the fact that, and that you watched the people who are finding, spring cleaning and working and one of the things that I think is extremely important to think about, and we are really on top of this, is how much harder it is for women during this pandemic. And I'm not saying it because, I think about the single moms. I think about moms taking the full responsibility of the children's education and their children's well-being, their food, everything in the house. And even though the current generation, the Gen Z or whatever you want to call them, are much better in partnership, I can tell you that the burden on women is twice, if not 3 times as much, but their pay is not that much. And they have a lot of work that's unpaid, unrecognized, unseen. And we absolutely must pay attention to that. At Women as One, we are very, very much focused on the fact that women physicians who are asked now to go back, think about women, and the frontline workers, for the most part, were women, because nurses are mostly women. The technicians are mostly women, honestly, believe it or not. And they were on top, they were there working, as well as having to leave their families because that was their job, to show up and be the frontline workers, plus the doctors who are the junior doctors that are mostly women, actually, believe it or not. Okay. And so what we saw is this unbelievable burden on mothers leaving their children and family for weeks because they didn't want to expose them with, leaving them with caretakers or families or what have you, but still having to deal with everything on top of, dealing with the horrific mental care, what it did to all of us, our mental health and our well-being, physicians' well-being, which no one talks about. If I'm not well in my head and in my mind and in my body, I can't do the best possible job for my patients. And so this whole idea of paying more attention to healthcare workers and their well-being is something that is unseen and unspoken. And we are the invisible army that takes care of everything in the house, as well as everything else that's going on in our daily work. And I'm just glad that you paid attention to that. And I'm really, really excited about working closer with you. I think I need to come back because we have so much to talk about.
I know.
We didn't get to talk about heart disease.
Well, the
fact that people are not coming in with their heart attacks. And they were sitting on their heart attacks because they were afraid to go to the hospital because they thought they would get COVID. And so many deaths happened because people didn't come to present with their heart attacks in a timely level and a timely basis. So we got to talk about that another time.
We got to talk about that. One more thing I would love for you to talk about as a cardiologist, right? By the way, a lot of the people that you said were women, there are a lot of Black and brown nurses.
Of course.
So you have that situation too.
100%.
And then the last thing, I'm sure, female heart disease. Big problem.
Heart disease in women, #1 cause of death for women in the United States and around the globe. I am leading a commission for the Lancet Journal on it's the 2020 vision for 2030. And we're going to give the commissioners work together to give all of our top 10 list of what you must do to reduce the burden and the morbidity, mortality of heart disease in women. And a lot of it is things you can't even imagine. Some of the intangibles of like dealing with domestic violence and the stress on women that has an important impact on their heart well-being. And so, and the fact that they present much later with their heart attacks, the fact that they don't know about the fact that they have their number one cause of death for them is actually heart disease, compared to 7 causes of cancer, including breast and colon and ovarian put together, and lung put together. Heart disease beats it. So we have to absolutely pay attention to this.
And I heard women, they have different symptoms,
right?
Symptoms. Like men have like this and women, yep.
Yes, and all the women on this call, I hope, will make sure that they know their numbers. The American Heart Association works extremely hard on this. We at Mt Sinai lead this work as well as, and honestly, make sure you know your number, your cholesterol, your blood pressure, your blood sugar, your hemoglobin A1C, your C-reactive protein, all of these important biomarkers that absolutely tell you what is going on in your body. And having those screening and understanding the good mental health, diet and exercise, and stress-free environment, time for yourselves, ladies, time for yourselves. I'm looking to do all of that, by the way.
Roxana, please, Roxana, share it's so amazing. I'm so grateful that our friend, who is actually one of our ZEITGUIDE guests, right?
Yes,
Miriam Bonakaram introduced us. I'm like so grateful. The last thing I want to just say, thank you for coming. I know we could be on for hours. People are going to be curious, but I like to end with some takeaways, and again, with the medicine and the new domesticity. These are the things I would love everybody to think about as you leave this. Obviously, everything that Nicole and Roxana about our health and our sanity needs to be taken. We need to take care of ourselves. But in terms of the takeaways in the new domesticity, what I've learned or thought about is that everyone you market to, right, in every product, because we have a lot of marketers here, everything has to have a home element. Like, you know, your car, makeup, like CVS showed how to, you know, really put your makeup on in a time of quarantine. The Bud commercial that I showed a few weeks ago, where you had the horse and the dog run, you know, so excited, and they went to a bar and it said, "We're open." It's probably not a good commercial moving forward. Gen Zs will be the more mature and progressive than any generation. The opposite is the mental health, which is going to be the next pandemic, I believe, that's going to be talked about because people are going to be in this new domesticity. Empathy towards teachers, empathy towards health workers. If you are wealthy and you're decided to homeschool, like my friends in Los Angeles, I would suggest maybe include at least one less fortunate student in your group. So if you have 10 students, why don't you bring on somebody that you think would have, you know, won't have the opportunity because of the family situation that they're coming from. And if you're trying to figure out where to donate, right, again, and these kids have to stay at home in Los Angeles and San Diego, you know, put money into homeschooling for the less fortunate. And here are my social handles. Next week, we're gonna, you know, I told you, ZEITGUIDE.com, thank you, if you want to contribute. And here are all the ones who are booked on our ZEITGUIDE for the rest of the summer semester, which is ending August 12th. So blessed that you keep coming. Next week, we're going to talk about philanthropy and toxic masculinity. Dan Doty has been covered on the Today Show about creating a program called The Everyman, which is teaching men about like why they were part or the bad part of the hashtag Me Too. A lot of them have been feeling guilty, not really understanding what it means to be a white privileged man. So he's going to talk about that program. We're going to have the Tony Award winning producer, Ron Simons, who did Ain't New Proud, Oh my God, I whatever. Ain't Too Proud. Is that what it's called, Jarvis? Thank you. The Color Purple, and David Nevins, who's now the Chief Creative Officer of CBS and the chairman of Showtime. Then I know we had Jana Rich talking about how to get our future jobs. She's a executive recruitment advisor. And we're going to have my friend Matt Seiler, who's going to come in, and they are trying to disrupt what corporate executive placement's all about not defining yourself as like the job you have, but defining yourself by who you are, like what makes you your skill set, so to speak. You know, I'm a curious person, so I should be called curiosity person, right? And that's what I should be hired for. Like, what are your best traits and how do you leverage that today for your next job when a lot of us are unemployed and furloughed? And then we're going to end with a woman named Tiffany Jana, and she wrote a book called Overcoming Bias, and a very special performance by a friend of mine named Princess Lockaroo. Her name is Samara. She is one of the leading, or she is the leading whacking expert in the world. For those of you who are watching Legendary on HBO Max about the competitions of the balls in the LGBTQI community. It started in the 80s. Ryan Murphy made a show about it called Pose, but this is, and which is all about voguing. This is before that, in the 70s, in terms of Soul Train. So that's the rest of the summer semester. I hope we can all keep doing this. I love it. For those of you who don't know, I also have a premium class, which is all me ZEITGUIDing, and then I do these customized for corporations. So anybody want to reach out, brad@zeitguide.com. I'll see you next week. It's going to be awesome. And I love you all. And thank you, Nicole, and thank you, Roxana. Thanks, everybody, for coming.
Thank you. Thank you for having me. Bye-bye.
Of course.